Okay, it's 3 o'clock. Everybody ready?
Yep, we're all set.
Okay, I'm ready to go. I just start speaking?
Yep.
All right. All right. Well, good afternoon, everyone. My name is Peter Dolkart, and on behalf of the Federal Reserve Bank of Richmond and the Baltimore Neighborhood Indicators Alliance, Jacob France Institute at the University of Baltimore, I want to welcome you to the opening plenary session of what essentially is the inaugural Baltimore Data Week. So Baltimore Data Week is this year's kind of innovation or evolution of our annual Baltimore Data Day. You know, in past years, many of you have joined us in person for what was an annual 2-day series of workshops during which community leaders, nonprofit organizations, government entities, and civic-minded citizens such as yourself came together to learn about the latest trends in community-based indicators and tools and how data is being used to support constructive change. Obviously, like many other institutions and throughout our society, the COVID-19 pandemic made in-person gatherings simply not possible. So we repurposed and readapted Baltimore Data Week, which now includes 20 virtual sessions ranging from the panel you'll hear today and the outstanding presentation that Seema Iyer did just an hour ago on the vital signs, as well as other types of workshops and mapathons over the next 5 consecutive days. This multi-session web format is really entirely new frontier for us at the Richmond Fed, but we think consistent with the theme of Baltimore Data Day and Baltimore Data Week, it is using the latest technology and tools to empower our communities. Now, I can say the one thing that is in fact consistent with every Data Day and now Data Week is that it apparently is once again the hottest day of the year. Traditionally, Artscape plays that role, but since we do not have Artscape, I can say that today definitely feels quite warm. So please avail yourself of the comfort of your home. Feel free to get yourself your own refreshment, and we will get going with this presentation. So we can jump to the next slide. So we have a really distinguished group of panelists. You know, when we were thinking of planning Baltimore Data Day this year, even before the pandemic, we were trying to think of a number of different topics, but once the pandemic occurred and we all found ourselves in the posture we've been in several months, it was clear from our stakeholders we talked to that clearly this is the topic they needed to know and wanted to know the most about. What, in fact, is the impact of COVID-19 on Baltimore's communities? And to some extent, can we project, if possible, what our community and life is going to be like as we move through this pandemic, and so on. So in a moment, I will be introducing each one of our distinguished panelists, and so on. Let me just kind of run through a few quick logistics or housekeeping items. So I'm going to share my screen. Okay, does everyone see my screen?
Yep, you're good. In the not the full setting view.
Yeah, are you seeing kind of the preview setting?
Yeah.
Okay. So I'm not certain how to adjust that, so we're just going to go with it as it is. Okay. So the first thing I need to do is give a quick disclaimer, which is that the views and opinions expressed are those of the speakers, and they do not represent an official position of the Federal Reserve Bank of Richmond or the Federal Reserve System. So anyone who's ever attended our programming knows that that is our favorite expression. It covers a variety of different scenarios. So the other thing I wanted to share with you, if you would indulge me, is that later this week on Thursday, we encourage you to join us for what we call Investment Connection, a live pitch session, in which a number of proposals that have submitted to the Federal Reserve Bank of Richmond, different proposals related to community development projects under the auspices of the Community Reinvestment Act, have submitted proposals. We reviewed them. We found them to meet preliminary eligibility for Community Reinvestment Act funding. And so now is an opportunity for them to pitch to an audience such as yourself, to banks, to foundations, and funders. We would love you to join that audience on Thursday at 10 o'clock from 10 a.m. to 11:30. We are going to be presenting 7 proposals who are going to give us their best Shark Tank 5-minute pitch on why their proposal needs funding. They are focused on the issues of digital equity primarily in terms of addressing the need for addressing the digital divide, how we can get computer equipment and digital access into the hands of households whose children who need to continue to learn, parents who need workforce and job training, access to social benefits, unemployment benefits. 5 of those proposals will focus on that. Additional proposals will focus on foreclosure prevention, food assistance and access, and also meeting a number of other social needs and so on, including workforce development and training, and so on. So please register for that. The link is on the same website as the rest of the Baltimore Data Week events, but we'd love you to be part of that. And then we're going to follow up with the same program in Washington on July 30th, where we'll be presenting 5 additional proposals addressing the most immediate pandemic urgent needs of the DC community, again, dealing with everything from small business access and assistance to food access, as well as rent loss and condo fee assistance. So please sign up for all of that programming and so on. Now let's move to our distinguished panel and so on. So our first speaker, Dr. Joshua Sharfstein, is Vice Dean for Public Health and Practice and Community Engagement. He's the director of the Bloomberg American Health Initiative and the professor of practice in health policy and management at the Johns Hopkins Bloomberg School of Public Health. Previously, he served as the secretary of the Maryland Department of Health and Mental Hygiene. He was the principal deputy commissioner at the U.S. Food and Drug Administration, and many of us remember him as our commissioner of health for Baltimore City. He's an elected member of the National Academy of Medicine and the National Academy of Public Administration. I also want to call to your attention that he's been doing this really fantastic and informative podcast called Public Health on Call, which he's both been producing and serving as the principal host, and you can access that actually on the Bloomberg Public Health site. In 2008, he was named Public Official of the Year by Governing Magazine, and I can't think of somebody more qualified who knows Baltimore and is more knowledgeable about this topic than Dr. Josh Sharfstein. So with that, I'm happy to turn the screen over to Dr. Sharfstein. Doctor, the webinar is yours.
Great, thank you very much. While I'm getting this ready, I'll just point out that you can get that podcast anywhere you get podcasts, not just on the Hopkins website. It's Public Health on Call.
Thank you.
Now let's see whether I can pull this off. Okay, can everybody see that?
Yes.
Great, so I'm just going to give a brief overview of COVID-19 in Baltimore to get the discussion going. We'll kind of zoom in. This is a map from this weekend of the United States from the Johns Hopkins coronavirus site. 3.6 million cases of coronavirus and 139,000 deaths as of this weekend. And you can see we're facing a continual upswing now. Sort of was slowing for a while and then growing number of cases every day in this country. So it's a pretty difficult situation nationally. Now in Maryland, there has been a recent increase, although it's not nearly as bad as other states like Florida, Texas, Arizona, California. And you can see that the Baltimore region has not been the hardest hit in the state. Actually, that title is reserved for Montgomery County and Prince George's County. This is the data from the city dashboard, which shows the city has a terrific dashboard, a lot of interesting facts on there, but you can see that the number of cases was going up until mid to end of May, and then started trending down, and lately has been going up again. So the deaths have not started trending up again, which is good, but it is right now a moment when it's quite possible that things get a lot worse here, like they have in other parts of the country. It's very hard to keep coronavirus out of any place, and we are certainly susceptible, like every place is, to a major outbreak. So far, we've had 355 confirmed deaths and 9,100 confirmed cases. Within the city, you can see the distribution of cases per 1,000 people, and you can see just a heavy preponderance here in Southeast, which is a big area for the Latino community in the city. Also, for a while, 21215 is one of the highest rates in this region. And you can see that it is a little bit of a mixed picture, but very clearly a huge problem in Southeast. So the challenges for the city go beyond just COVID. It's all the consequences of the pandemic and of the economic disruption. So one major one is food insecurity. And fortunately, the federal government expanded access to SNAP benefits, but the Latino community, which has been hit so hard, generally does not have access to that program nearly as much as others. So there have been major food distribution projects. I think the city gets an enormous amount of credit for what it has done. They've worked with Coastal Produce and others to distribute meals, produce, and grocery boxes. This is some of the latest information about that. Housing is another problem. You know, it's not so much density of housing as it is crowding of housing that's puts people at risk. And it's another threat to the Latino community because there's a lot of crowding in Southeast. And what you can do, there's not much you can do to isolate if you're with like 5 other people in a room. So what you really need to do is move people out. And so the city has been doing some of that, maintaining some hotels for people who do not have the capability of self-isolating at home. And then job loss is obviously a huge one because that is, a problem everywhere. It's particularly a problem in neighborhoods that have a lot of low-income residents to begin with, and it's a very part of the core social challenge right now, because with job loss comes food insecurity, comes housing instability. There have been moratoriums on evictions. There have been obviously unemployment benefits, but those are scheduled to run out in a couple of weeks, and the eviction prohibitions are also scheduled to run out. So we're very focused. I think the city is very concerned about the consequences of the social and economic disruption. One of the strategies the city is using is trying to raise money, and they raise money from foundations and elsewhere to hire people in Baltimore to fight COVID, which is a little bit of a 2-for-1 because you get the jobs of people for fighting COVID, and then by reducing COVID, you allow for more of an economic opening again. And then you have the challenge of just maintaining vigilance. And it's a huge problem. This has been an exhausting process for everyone. And it's very important for people to wear masks, stay inside as much as they can, wash their hands frequently. And the Baltimore City Health Department has been doing a whole series of different kinds of ads through the public-private partnership that was set up with Johns Hopkins, the University of Maryland. The city has been trying to get messages out around the city. But this challenge is an ongoing challenge, and particularly as people get tired, it's hard to maintain. And all of this, for all that work, we have gotten the cases down, but now they're starting to come up, and we're at risk for new waves of infection, particularly during the flu season and cold season, but even before then, as a result of just massive infections in the South. I mean, people travel around this country, particularly in the summer. So there's just likely multiple introductions of the virus, again, happening in Baltimore. I think that the city has unquestionably saved lives through its public sector leadership, public-private partnership, and most importantly, the actions of so many city residents. But we're really not at the end. We're more like maybe a third of the way through this right now. And the key challenges for the city include mobilizing a contact tracing system quickly and effectively so that we can respond to individual cases. I don't think anyone would really say the system is where we ultimately want it. There is some contact tracing in the city, but it's not fully developed. A lot of efforts going on to improve it. Reopen schools as safely as possible because kids are suffering without being in school, and this is very challenging, particularly without extra resources that could be put to good use for transportation and hiring more staff and using more space. Continuing to try to meet the social and economic needs of city residents, which will get harder if the federal support starts to drop off, particularly. And really making sure that all of these different things work across the city from Park Heights to Southeast, with a special eye to the Latino community, which has been, such a big hotspot in this city. And making sure that solutions are accessible to people who may not be citizens or permanent residents. So that is my brief overview, Peter, and I hope this is what you were hoping for, and I'm looking forward to hearing the other presentations.
Thank you, Dr. Sharfstein. Yes, that it was, and so on. So I was remiss before I started with a little housekeeping to say that please, ladies and gentlemen of the audience, please post your questions for any of the panelists and all of the panelists in the chat section so that we can move forward and have a lively discussion. I was planning to ask some initial questions after each speaker, and then open it up to a few questions from the audience, and then open it up to a broader discussion after each panelist, and so on. So actually, since one of the, Rudy was the first to post, Dr. Sharfstein, is there data on healthcare access during the pandemic and/or testing stations by neighborhood?
So I don't know how much good data there is on testing stations by neighborhood. I think one thing that the city did early on, which I thought was a very positive thing, is they turned the 311 line into testing access. And so people could call and they could get referred for testing regardless of whether they had their own doctors. In a lot of places, you really had to have your own doctor even to get testing. And Baltimore sort of created a workaround to that pretty quickly. So I think that was a very positive thing to do. The testing, there are some community testing sites, but the goal is really to have community testing sites right there in the communities with the highest risk. So, the one at the Pimlico Racetrack near Park Heights, that's a good one to have. There is now a focus. There's been some, frustration over getting one set up in Southeast, but that's a very important area for there to be really rapid testing. And I think for most people would say that there wasn't adequate, fast enough, broad enough testing in that area. So I think the thing to think about here is both, sites, but particularly sites in the neighborhoods that are most affected. Detroit, for example, has mobile testing that they'll drive around to different areas and try to get testing. The second thing to keep in mind is that testing is really only valuable if you get the results quickly. It has to be testing plus results plus follow-up, not just testing. And so a lot of places are focusing on, well, how many tests and how many tests? Well, just the test alone doesn't tell you whether it's a useful test or not. And so you really want to see the result in 1 or 2 days. And then that really needs to be linked to contact tracing. And here, Baltimore, like many areas, is behind. There's certainly University of Maryland and Johns Hopkins is able to turn around tests a little faster, though they're getting a little strained. But most of the other testing facilities are right now running 5 to 7 days, which is very, very hard. It's very limited for diagnosis, very limited for public health capacity. So I would say that there's sort of bright spots and some not so good spots when it comes to the testing situation in the city right now.
Yeah, indeed. I believe the governor of Colorado just expressed his frustration recently in the news about the fact that it's taking 6, 7, 8 days in his state to get the testing result back, and so on. So I was curious about your slides, and while this is primarily focused on the Baltimore metro area, I do need to ask, what accounts for the fact that Montgomery and Prince George's County seem to have such a large number, even more than the city, in initial cases?
Good. And there's a note saying that there has been some mobile testing in Baltimore, which is good. I don't know if it's mobile in the sense of, well, what sense it's mobile, but I think it's good. I think it should be in the neighborhoods where you're seeing the high cases. So, sorry, your question was about schools?
Well, I was just curious why those two counties in Montgomery and Prince George's jumps out so far ahead early on and seem to continue to lead the state. It appears to be in cases.
I think there are probably a couple reasons for that. They may have been seeded earlier, in part because maybe more people traveling from those areas. In Montgomery County, there were a number of cases from people traveling. The second reason, I think, is that there are also been very large numbers of people who have had just high risk for infection because of the nature of their living conditions and the kind of work that they do. We know in Prince George's County, for example, the Latino community has been also hit extremely hard, and that is a much bigger Latino community than in Baltimore City. So I can't tell you all the reasons, but and I think some of it's a little bit random in terms of where the cases started, but they certainly have had a much larger problem. But that doesn't mean that's going to continue. Right.
And then the slide you had, which showed the city in terms of the various zip codes and areas or census tracts where it has happened. From your experience, is the COVID-19 pandemic following a similar pattern in terms of other epidemics that have come through the city in terms of areas that are most impacted, or are there any differences we're seeing?
Well, we haven't really had this kind of pandemic since 1918, which was not good for Baltimore, that experience. And I think there were big parts. I think that one of the things we've certainly learned nationally and in Baltimore is that this pandemic uncovers inequities of all kinds. It uncovers difficulties accessing healthcare. So if you've had difficulty accessing healthcare regularly, then that's becomes much more of a challenge during the pandemic. And there have been some things the city has done to, like I said before, to try to limit that, but it's just the national problem. It uncovers inequity in the kind of jobs that people have and how they can protect themselves in their access to transportation and safe housing. And so what we're seeing is that communities where these have been longstanding challenges are communities that are going to be hit harder, both in terms of number of infections and quite possibly the severity of the infections. In part because people may be exposed to a higher dose of virus and because of the nature of their exposure, and in part because they may have complicating chronic illness that puts them at higher risk. So it's been a very challenging situation for this, and I think this pandemic, like all pandemics in different ways, reflects the underlying challenges in society, and basically in order to do better for the pandemic, we have to pay attention to them. And it's not just putting testing in those neighborhoods and making sure contact tracers are able to, relate to people there, which are sort of the immediate things to do. But it's thinking about what is the challenge facing essential employees? What are the challenges in the transportation system? What types of housing policies would make it less crowded? And hopefully, that this, by uncovering the problems, this will create more momentum to some of the underlying urban injustices that exist.
Appreciate it. Some people have been nice enough, some of our participants, to post further information about mobile testing and additional links in the chat. So I thank the participants. I did see somebody posted a question about the schools. Why don't we wait for that towards the general conversation? But somebody did pose the question about, would it be helpful for somebody to essentially do their own charting and tracking of their own daily routine, essentially doing their own tracing of contacts and providing that to officials? Is that a useful exercise?
Yeah, the most important thing for people to do is to maintain their distance from other people to the extent possible. So that's really, 6 feet of distance, wear a mask when you go out, and stay, for at least, you don't want to be within 6 feet for more than 10 or 15 minutes if you can avoid it for anyone outside of your household. I mean, you really want to limit that completely. If you are in that situation, writing it down is a good idea, because then if it turns out that you're positive, you might be able to immediately tell the contact tracer, here are the people that I was close to. But the people who are at risk are not the people you walked by on the street. They're the people that you've been in close contact with. And the best protection is just not to be in close contact with people if you can avoid it. And so that means, in the workplace, if to the extent possible, redesigning the workplace, going in at different hours, working from home if you can, wearing masks, and then, but as a backup, if you really are for whatever reason, near people, then yes, write it down. But I think the better thing is to be extra protective so that there's really nobody to put on your list if you're keeping a list.
Yeah, that's a good suggestion. So I'll ask one more question because I think it's very compelling before we move on to our next panelist, which is how can we explain the much higher fatality rate for African Americans than Hispanics or Caucasian cohorts or groups?
So, in this area, it has to do with a couple factors. Probably the biggest one is the fact that there's a higher fatality rate among people with who are older and who have certain types of conditions, including hypertension and diabetes. And so African Americans much more likely to have high blood pressure or diabetes, for example. And so if they get the coronavirus, they are at higher risk. It's also maybe true that they are exposed to a higher amount of virus because of the nature of their exposure. Say it's because they're working in a job like a supermarket clerk where they're exposed indoors to, early on, their exposure might have been higher. So it's a combination of exposure plus your underlying predisposition for severe disease. Now, something that's really important to keep in mind, though, is that underlying predisposition for severe disease doesn't come out of nowhere. And in fact, on the podcast, I interviewed the chief medical officer of the American Heart Association, and he was talking about, well, let's take a step back and ask, why do African Americans have a higher risk for hypertension and diabetes? And that has a lot to do with their access to food, the nature of neighborhoods that people live in, stress that they have experienced, racism that they've experienced. All those things contribute in different ways. There's a big literature on that, to hypertension and diabetes. So it's sort of unfortunate in this way, but you can think of it as there's the direct impact of inequality that is causing these enormous disparities. I mean, it's like 4 to 5-fold increase in hospitalization rates for African Americans and Latinos, higher for African Americans. And so it's direct because more likely to be exposed, more likely probably to get a higher dose of exposure, and indirect because they're more likely to have hypertension and diabetes, which are predisposing for severe illness. But those are indirect consequences of challenges with housing, transportation, access to food, and other things. So all those, inequitable social conditions add up to this absolutely unjust outcome.
Yes, so indeed the pandemic is just taking all of those inequities and essentially giving us an immediate reckoning for them as we speak as currently. So, well, thank you, Dr. Sharfstein. So I'm going to turn to our next panelist, Michael Kelly. Michael Kelly is the Executive Director of the Baltimore Metropolitan Council, the council of governments serving the Baltimore region. Prior to this appointment, Mike served as BMC's General Counsel and Coordinator of Government Relations. Since 2011, Mike has been the director of the Opportunity Collaborative. Mike is a graduate of Loyola University, and I can tell you firsthand, he is also a graduate of the University of Baltimore School of Law. Mike, please.
Great. Thank you, Peter and Seema and everybody for joining us today. I'm going to present some information largely at the metropolitan level on a range of topics. At BMC, we help Baltimore City and the surrounding governments cooperate across a number of policy areas. First and foremost, transportation, but I want to talk a little bit about, what we do know and what we don't know about these impacts so far, and what we're trying to do over the next year or so to really measure what these impacts are in the best way possible. So starting off with transportation, one thing we have been able to do is see week by week and day by day, in some cases, exactly what is happening in our transportation system. So here is weekly traffic counts from MDOT from their traffic cameras, 2019 versus now, and you can see that in April it got down as low as 54% below last year. And in recent weeks, we're up to about 23% below. But you can see traffic starting to come back after the stay-at-home order was lifted. And it's one way of sort of giving us a leading indicator about where infections may be happening, where the economy may be rebounding, and where we might need to be concerned about people being out and about a little bit too much. Another thing we can track on a daily basis are the crossings on the Bay Bridge. And you can see at this point, this is the last 3 years with 2018 and 2019 at the top of the screen. And you can see that traffic is almost back to normal, moving back and forth across the Bay Bridge, which is great news for folks who like to go to the beach, but again, something to be concerned about as we think about congregating, as we think about the kind of places where outbreaks and spread may occur. Recently, we've started to look at cell phone data in the aggregate to get a sense of who's staying at home and who's moving out and about. And this is 3 of our jurisdictions from January to the end of June. So you have Baltimore City, Howard County, and Queen Anne's County modeled here. And you can see, in general, Baltimore City residents before this all started were staying home and not moving that far, which isn't surprising. Compared to the more rural jurisdictions. But once the public schools closed and the stay-at-home order was lifted, it's interesting to note that Howard County residents immediately started staying home at the same elevated rate as Baltimore City residents. And in one sense, this may be because Howard County residents are rule followers and want to do the right thing. But it's also indicative of sort of the privilege that this pandemic is unearthing, where in Howard County, you have one of the highest paid, most educated populations at the county level in the entire country. And more likely than not, you have a lot of folks who were able to telework, whose jobs were able to transfer to them to home fairly seamlessly, so that they could stay safe, so that they could, stop the spread of this disease. Other jurisdictions may not be as lucky. Queen Anne's County has a lot of agriculture, a lot of our frontline workers, a lot of folks who travel from the eastern shore to the western shore to work in our hospitals, to work in our schools, to work in our retail establishments, and folks who may not be able to stay home as much as in some of our wealthier jurisdictions. Transit ridership, not surprisingly, plummeted compared to 2019. You can see it was dipping a little bit even before the state of emergency, dropping as low as a 78% drop over 2019, and still down at about 60% below last year's numbers. Again, the folks still riding transit are most likely the people who have to. There's not a lot of choice riders on our buses and trains right now. And one thing we all need to be thinking about are what we can do to keep the operators of these vehicles and the passengers of these vehicles as safe as possible with PPE, with social distancing and other measures to make sure people who really do need to rely on public transportation to get to where they need to be can do so. All of this does not paint a good picture of transportation in the next couple of years in Maryland. Through April, our car sales were down 57%. Traffic counts down 52%. MDOT has publicly estimated revenue drops of about $550 million. And the impacts for FY21 are between 490 and 560 million. That's after using a surplus and CARES Act funding as a stopgap for FY20. On top of this, there was a $2 billion funding gap over about 10 years for the state of good repair for our transit system. So there's a lot of movement and a lot of conversation about investing and reinvesting in Baltimore's transportation system, especially our public transportation system. And these budget impacts are gonna be a big deal over the next few years. You can see on the right is a breakdown of the revenue that makes up the Transportation Trust Fund. Motor fuel tax is 23% of that, almost a quarter. Well, nobody's driving. Titling tax and registration fees are another 28%, but our car sales are way down. Even operating revenue from the MTA, from tolls, is down about 10%. So as we look for next year and the coming years, transportation budgets are really going to be challenged, and it's going to be important for us to advocate for people who really rely on public transportation to make sure that they can stay active members of the economy through the pandemic and even after the pandemic ends and we're able to open a little bit. We've had trouble tracking too much on the housing side of things. We're waiting for a lot of data to be released. This is some back of the envelope analysis our staff did. The map on the left shows the density of Hispanic population with a focus on Baltimore City. And this is exactly what Dr. Sharfstein was showing us. There are 7 census tracts in Southeast Baltimore that make up about 3% of the city's population. These census tracts have between 20 and 40% Hispanic population, and they remain about 10% of the reported cases in the city. And I'm not going to get into whether or not there's underreporting there. My assumption is that this set of maps does not actually capture the reality of what's happening there. But it clearly shows that the pandemic is highlighting specific communities geographically, as well as racially and ethnically. And that's something we need to be cognizant of over the next year. The jurisdictions have done a great job focusing on rental assistance. The governor still has a ban on evictions. There is now a fairly public conversation about how long that is going to last. At some point, evictions will begin occurring again, and we are likely to see a housing crisis take place. But at the local level, BMC is a very active housing committee, and our local housing agencies have done a good job shifting CARES Act funding to try and assist renters and keep people in their homes where they can be safe for as long as possible. On the right here, you see a map we call our composite opportunity map. This is something we did a few years ago in a program called the Opportunity Collaborative. It sort of measures in quintiles relative opportunity throughout the region. Essentially, the darker areas are the places with the best schools, the lowest unemployment rates, low crime rates, the places where you would want to live. And the lighter areas are places that have more challenges. And ultimately, one thing we want to do at BMC is start tracking COVID health data over these opportunity areas to see how blind the pandemic is, or to see how much, how disparate the impact of the pandemic is on different communities throughout the region. Unemployment data it has been one of the things we've been able to track in some detail early on. You can see here, these are the initial UI claims, and this is a table that's taken from a dashboard that BMC has put up that tracks sort of regular traditional UI claims as well as UI claims from the CARES Act. And you can see, you know, in the first few weeks it peaked the way we all remember. There was a second peak that occurred at the end of April when the CARES Act funding kicked in. And one thing to track and keep an eye on is that you can see down in Anne Arundel County, which is indicative of the rest of our jurisdictions, the claims keep dropping on a week-by-week basis. But in Baltimore City, those claims are stagnant, if not rising a little bit, which is something to keep an eye on as we talk about starting to come out of this in the next year or so. Through April, we were able to collect unemployment claims by jurisdiction and by industry. And these are at the metropolitan level. So it's Baltimore City and 6 surrounding jurisdictions. But through April, in all our industries, we had 183,000 new claims. It was a huge number. Again, you can see week by week exactly where those claims stacked up. The top 3 industries were accommodation and food services, healthcare and social assistance, and retail trade. And you can see in that same time period, those 3 industries made up half the claim. So we sort of knew immediately, and it wasn't really a surprise to anyone, the workers in the industries that were going to be most impacted by this. In terms of what's going to happen moving forward, the challenge with labor market analysis is that it's lagging. We're not going to know until November or December exactly what happened from March through July and July through September. The federal government releases those numbers late. So we're going to have to make some guesses and use some predictive measures to make some assumptions about who's being impacted right now. So one thing my staff has done, and I've got a couple folks on the webinar right now who helped put all this together. The University of Chicago, Brookings, and a few others have come up with these most exposed employment sectors. We're using the University of Chicago model, and it identifies industries that are most likely to be hurt by the pandemic, both through job loss, through revenue loss, and through sort of bleed over into other industries through general economic activity. In our region, this is about 250,000 jobs. It's 18.3% of the total jobs in the region. And the places these jobs, or at least the industries they exist in, aren't really a surprise. It's restaurants and bars, it's sensitive retail, which are just, sort of your brick and mortar shops that rely on foot traffic, travel and transportation, entertainment venues, personal services, and sensitive manufacturing that is reliant on physical manpower as well as demand to purchase the things manufactured. When you look at these exposed sectors, and we've done a little bit to try and identify from a demographic standpoint who these people may be. You can see at the bottom, the wage distribution in other sectors, while it's geared towards the lower end of the wage spectrum to those $15, $20 an hour jobs, it's fairly spread out as you move into higher wage jobs. In these most exposed sectors, 46, 47% of the jobs are at the $10 to $15 an hour range. We're talking about our low income workers who were probably already at or on the edge of the poverty line. In Baltimore City, when we look at the wage share by sector type, the orange chart shows us the exposed jobs in Baltimore City. It's 12% of the jobs in Baltimore City. The employees in those jobs are 62% of the people making $12 an hour or less, 43% of the people making $14 an hour or less. Only when you get to $20 an hour or more do you see that the other sectors start taking a highly predominant share of the job. So in Baltimore City, especially, these most exposed jobs, the jobs that are most likely to be lost or impacted by this, are the low wage jobs. And you can see the sort of heavy-handed impact this is going to have on people in poverty. We've also done the same analysis of wage share by race, and it's not as stark as you can see with the wage share by sector type. But when you look at it by race, you can see that Black employees are 36% of the city workforce, meaning 36% of the jobs in Baltimore City, not necessarily city residents, but the jobs that actually physically exist or virtually exist in Baltimore City, as the case may be. And up to that $16 an hour wage, these Black employees are sort of outpacing their share of these lower end jobs. But again, when you get to that $20 an hour threshold, which is right about where we start tracking family supporting or living wage jobs, white employees start taking a higher and higher share of the opportunities. These slides are probably not a surprise to anyone on this call, but they should be a wake-up call about who is going to be impacted and what those impacts might look like moving forward. BMC, as I mentioned, has a recovery dashboard posted. Right now we have transportation data, some of this labor market data, and the unemployment data we've been able to get. We have only been able to get this sector level unemployment data through April. The state is working very hard to go through reams and reams of claims. So once they're ready to share and update that data, we'll have a better sense of where things are. This is something our board wants us to keep moving for the next couple of years. We want to add to this. We want to make sure that we're looking at data and indicators at the metro level that can be of public use to the public, of sort of general informational use, but also can help our policymakers make decisions. So the website is there. We'd love to have suggestions. We'd love to hear thoughts. If there's things that people think we should try and track at the regional level, we're really happy to try and do it. You can only, one of the ways we're all going to get through this is by being as educated and aware as possible, and we're trying to do our part to help in that effort as much as we can. So with that said, thank you. Peter, I'm happy to answer any questions, or at least try to answer questions folks may have.
Sure, thank you, Mike. And also my compliments to your staff on the really thorough job they're doing and so on. Yeah, there are some number of great questions. My initial question, though, is has the MTA or ever faced this type of revenue shortfall, at least in your memory or in past? In the past, have they ever faced this dramatic a shift in revenue?
No, it is important to note that fare recovery is a small piece of the pie in MTA's budget. It's not sort of their predominant income source, but it is significant. It is something to look at. It's actually the event that this makes me think of is the spike we saw in gasoline in 2008, 2009, where the opposite thing happened, where you started seeing MTA numbers skyrocket because people couldn't afford to put gas in their tanks. So it's sort of the opposite of what we've seen in the last decade.
I see. A lot of great questions, but on the issue of the MTA, one of the people posted the fact that you're seeing in Europe and a number of other countries abilities to find alternative means to public transportation, more bikes and more other types of opportunities. I am struck, by the way, that it occurs to me, I live in downtown, that I have not seen the scooters and the things that were omnipresent prior to the pandemic. They seem to have disappeared, at least in my area, where before they were everywhere. I did notice that, in fact, somebody in an op-ed in The Sun encouraged the soon-to-be incoming mayoral administration to embrace urbanism and possibly even start a new bike sharing program. Again, has BMC thought about that or had any approach to thinking of alternatives to the standard transportation options?
Well, right before all this broke, we hired, we created a new position called a micro-mobility planner to try and catch up to the curve nationally that you're seeing of all these different mode share opportunities. And I think it's a little early to see where it's going to go, but I think once we're able to come out and move around a little more freely, you are going to see a greater desire for bike share, for scooters if it can be done safely. I think you're going to see people want to live closer to their work to shorten some of these commute times up. I'm not sure what it's going to look like, but I think the desire is going to be there, and policymakers are going to have to respond, as is the market. I think the private sector is going to have a lot to say. We've learned some lessons from our most recent shot at bike share, from sort of opening our streets up to scooters at large. So I think it'll be interesting to see what the evolution of that is, but I think we're definitely going to see more of it, and we should.
Yeah. One more question, then I'm happy to turn it over to our next panelist. But somebody noted that there seemed to be a large spike in unemployment applications, I think around June 7th. I also was curious that of course, there was about a month ago or more, a big concern about the fact that the state's unemployment insurance website was not functioning the way people expected it to. It kind of reminded us of what happened with the healthcare exchange some years ago. Has all of that been factored into your numbers, and what can you speak to why there was such a big spike just at the beginning of last month?
So I think the spike at the beginning of last month, and I'm going to look at my slide just to make sure I'm right, but I believe that's when the CARES Act funding kicked in. So you sort of had the CARES Act offered unemployment to people who typically didn't get it. So you would see that in May. I'm not sure it looks like in the city there was a bit of another spike in June. I'm not sure what that was from. But the CARES Act, it offered unemployment to people who traditionally were not eligible. So that's why at the end of May, at least, you saw that second spike. I don't know what the one in the city was attributable to. And the state was dealing with 50 times the regular amount of claims over a sustained period of weeks. I know there's been a lot of discussion about processing those claims and getting through them. As far as I know, it has not all been taken care of. But I think there was an avalanche of these claims that came through at a time when the state was also going virtual, and you had a lot of employees dealing with a lot of challenges at the state level. So hopefully it's something that can be cleared up, and we can learn some lessons about how to process these things better in the future.
Thanks, Mike. Well, we have a lot of great questions. You mentioned the fact that on the issue of housing, and that the numbers are still kind of coming in. Unfortunately, we have a panelist who I think can at least fill in some of the picture on that. So Jenny Schuetz is a fellow at the Metropolitan Policy Program at Brookings Institute. She's an expert in urban economics and housing policy, focusing particularly on housing affordability. Jenny has written extensively on land use regulation, housing prices, urban amenities, and neighborhood change. She's appeared in the New York Times, Wall Street Journal, Washington Post, Financial Times, The Economist, Vox, and Slate. Before joining Brookings, Jenny served as principal economist in the Division of Consumer and Community Affairs at the Board of Governors of the Federal Reserve System. Somehow you found a way out of there, broke free. She was also an assistant professor at the University of Southern California and a postdoctoral fellow at NYU's Furman Center for Real Estate and Urban Policy. I might add that they were one of our presenters just a couple years ago on housing affordability. Jenny is a non-resident senior fellow at GW's Center for Washington Area Studies and teaches at Georgetown's Urban Planning Program. She earned her PhD in public policy from Harvard University, a master's in city planning from MIT, and a BA with the highest distinction in economics and political and social thought from the University of Virginia. Jenny, please.
Thanks for giving me a chance to come and talk to you guys. I'm sorry I didn't get to come up to Baltimore in person. That's one of my favorite trips to make from DC, to come up and visit with you. But sitting here in DC, I will share some slides with you. So as we've heard a couple of times from Peter, from Mike, and from Dr. Sharfstein, one of the things that we've been quite nervous about is that when people lose their jobs, they also lose the ability to pay for housing. And so a number of us have been watching the impact of both the public health crisis, but also very much the economic crisis on housing markets. So I'll give you just a little bit of a big overview of what we know so far. And I'm really going to spend most of the presentation talking about some of the data limitations to being able to track exactly what's going on in housing markets, because that's a big hole in our knowledge at the moment. So we know that the pandemic and the economic recession that followed have really harmed financial security for households. And this has fallen most heavily on households who are earning low incomes, low wages. We know that low-income Black and Latino workers have been hardest hit by the job losses. They are more concentrated in some of those sensitive industries that Mike was sharing. So they've had bigger impacts with that. They're also, Black and Latino workers are more likely to be in essential jobs, meaning they have to go to work, they have to be in contact with people. So they've also borne very much the brunt of the health impacts. Many of the households that are being hurt the most by the pandemic were already financially insecure and having a difficult time paying for housing. We know that before the pandemic hit, nationally, more than 10 million households across the US were spending more than half of their income every month on rent. That leaves them very little to set aside, to save for a rainy day. And so these are really very, very vulnerable households who are now going through a particularly difficult time. There have been some policy responses aimed directly at easing the burden of housing for households. The Federal CARES Act, which we've talked a little bit about so far, has a couple of protections both for homeowners and for renters. And it's important to recognize here that the federal government has a lot more levers on the homeownership market through its regulation of mortgage markets, and in particular, through the role of Fannie Mae and Freddie Mac in providing mortgages for a very large share of homeowners. And so the CARES Act and subsequent work through the Federal Housing Finance Administration basically gave a year's worth of forbearance to borrowers, to homeowners who have a mortgage through Fannie or Freddie. So they are allowed to stop making their mortgage payments for up to a year if they have lost income because of the pandemic. And that's something that the federal government has just the ability to sort of wave a magic wand and say, it's okay, mortgage companies, banks shouldn't be pressing for foreclosure because we recognize that this is an unusual time. The federal government just doesn't have that same kind of leverage when it comes to renters. Most renters in the US rent from private landlords, and the contracts between landlords and tenants are governed by states rather than by the federal government. And eviction proceedings are carried out through local court systems, through county courts and governments. Because of that, it's really incumbent on the state and local governments to figure out what they can do to protect renters. As we've mentioned, Maryland, Baltimore City, a number of state and local governments have adopted these temporary eviction moratoria. And in fact, many cases, the court systems have been shut down, and so they're not processing evictions in the short run. That is very definitely a patchwork and a Band-Aid in the short run. The fundamental problem is that people are running out of money to pay the rent, and landlords, many of them have pretty thin margins. If tenants aren't paying the rent, then landlords can't pay the mortgage, can't pay the property taxes. So in fact, the most important thing that we've seen so far in policy for helping both renters and homeowners stay housed is just the income support. So it's not directly aimed at housing, but the expanded unemployment insurance benefits and the one-time stimulus checks have been enormously helpful in helping people continue to make their housing payments, continue to buy food, make their utility payments. And it's going to be very disturbing when those expanded unemployment insurance benefits come to an end in the next week to 10 days. So hopefully Congress will up another round of that because that's really been keeping people where they are. So I want to talk a little bit about some of the data sources that we have for measuring housing insecurity and some of the pros and cons of these different data sources. As Mike was showing you, there's actually a lot of pretty close to real-time information on labor markets. So every week we get updates on the number of unemployment claims, and we get that down to the state level and sometimes even smaller and broken out by industry. So we get these weekly updates. Every month the federal government releases information on jobs that are created and lost. Housing statistics don't come out all that often, and many of the housing statistics are lagging. So things like the number of home sales or the number of building permits for new construction, that tells you sort of how optimistic people are for very far in the future, but not the kind of financial pressures on individual households going on right now. So we have not a lot of real-time data. There are a handful of new data sources that have sprung up, recognizing that we need to have some sense of what's going on and how people are doing. So I'm going to talk to you about 3 of those. The first is the Census Bureau's Household Pulse Survey. And I'm going to show you a little bit more about what's in there. That's probably our best data source to date. And so if you haven't been using it yet, I highly recommend it. There is a rent payment tracker that's put out by the National Multifamily Housing Council. That's an industry association for mostly larger apartment buildings. And that also gives us some real-time information. And then the third is a survey from the Federal Reserve Board's Survey of Household Economics and Decision Making. They've done a supplemental survey in April, and I believe are going to be putting out another one at some point this summer. So I'm going to focus mostly on the Household Pulse Survey because this is really just a terrific data source. It's very accessible. So I've included here the website so that you can go to this. There are actually 2 surveys that the Census Bureau is doing in real time. This one is focused on households. So the people get a text message on their phone that asks them to report and just a very short list of questions to get real-time information. They're putting out results every week, which is very fast for the Census Bureau to do a survey, tabulate the results, and then share this. There's also a survey that's going to business owners that's asking questions about how the businesses are doing. I didn't pull that out because it's a little bit less relevant for housing, but worth looking at as well as a good data source. So you can see this is just a screenshot of what the website looks like. The Household Pulse Survey is this attempt to get information on how households are doing. And they ask a number of different kinds of questions about whether people have lost their jobs, whether they've lost income, their health impact, so how people are doing, a variety of different kinds of indicators on financial stress and well-being. Conveniently for us, there are a couple of different questions they ask about their housing situation. And so I've pulled up just a list here that shows you the tables on housing that they provide. And I will say one of the very nice things about this survey is that they make tables that are really easy to just pull up and look at very quickly and easily and find the information. The survey data is released every week for the nation overall, for each of the individual states, and for the 15 largest metro areas. So unfortunately, Baltimore is not one of the metros that's been pulled out. So I'm going to show you some data for the state of Maryland, which is the smallest level we can get to because this is a relatively small survey, they don't go down. So the 4 tables that they track, they ask people whether they own or rent their home. And then for each set, owners and renters separately, they ask whether they made their payment last month. Did you make your mortgage payment or your rent payment in the last month? Yes or no. And whether it was deferred. So for instance, if you're getting mortgage forbearance, then they also ask people's confidence in whether they will be able to make their payment the next month. So it's very helpful that we have this forward-looking information. And this is the self-assessment. You know, do you think that you're going to have enough hours you'll be able to make your rent or your mortgage next month? So I pulled just the results for a couple of the key questions for the state of Maryland and for the US overall. So one of the sort of top line questions is whether or not the household has lost employment income. So that could be losing your job altogether or having your hours cut so that you're earning less money. And you can see, you know, Maryland looks about like the US overall. These are really high numbers, right? So 48% of Maryland's renters and 44% of owners have lost some amount of income. This was for the end of June. So nearly half of the households have lost income. I mean, that's just an enormous shock to the demand side. We've never seen something this large, even in the Great Recession. Then looking specifically at the housing questions, so at the end of June, more than a quarter of Maryland's renter households said that they didn't pay their rent in the month of June. That's also a very high number. That is a really unusual number. And you can see that although owners were almost as likely to lose income, they were much less likely to say that they had missed a housing payment. And some of this is that owners tend to be higher income, they tend to have higher wealth, they have more resources, so they're more likely to be able to sort of cover expenses for a couple of months if they lose a job. And renters really were on a very thin financial margin to start with. The picture looks even worse looking forward. So when asked whether you think you can make your rent payment the next month, 31% of Maryland's renters said they either have slight confidence or no confidence that they can make the next month's rent payment. And for owners, this is again higher than the current month, but much, much less, right? So renters are doing worse than owners. Maryland is doing a little bit worse than the US overall when it comes to renters, and these numbers are really bad. So I want to contrast that to one of the other data sources we have, which is this rent payment tracker from the National Multifamily Housing Council. What's really important to know is that the data that they're presenting comes from relatively large professionally managed apartment buildings that use professional software systems to track rent payments. So the data behind this is actually coming from the software companies. So when people send in their rent check to their landlord, the landlord sort of checks off on a spreadsheet in their computer and says, this household made a rent payment, this household didn't. All of the data gets picked up from the property level and then sent back to the software company. And so they're able to tell us for the whole country as a whole, how many people living in these buildings have been making their rent payments. The numbers on this look much better than on the Census Pulse survey. So you can see that as of the sort of the middle of the month in 2020, starting in April, which is when they first rolled this new tool out, 85 to 90% of renters were making at least a partial payment of their rent. So it may not be all of it, but at least partial payment. So those numbers look a whole lot better than what we saw overall with the number of renters, and particularly when we drill down to Maryland renters, right? So you can see that a quarter of Maryland renters didn't make their payment. That's a larger number than what's showing up here. So some of this is that the NMHC rent tracker excludes most of the really small mom and pop buildings, and that's where low-income renters are more likely to live. So I point this out just as this is a super useful tool that we have, but be aware that where the data is coming from is going to affect the results a little bit, so to be cautious about that. Then the last data set I want to tell you about is this supplemental survey from the Federal Reserve Board. Every year they put out a report on the economic well-being of households. It covers just an enormous range of questions. It's a terrific resource, and I recommend you spend some time looking at it. The survey normally gets done in October, and the report comes out in June. So this year they realized that asking people last October how they're doing and then having this national crisis in the middle of it was going to give them less useful results. So they did a supplemental survey in March and asked people questions specifically about how well they had been doing, whether they had lost a job, what their financial status was early still in the pandemic. And so I didn't pull up the results for this. I will say that this is also a survey where you can get data down to the state level and the metro level. And so it's worth looking to see what some of the results are on that one. And then I just wanted to close by pointing out that many of you who are listening, who work for nonprofit organizations, for state and local governments, you're much closer to the ground, and you're probably seeing a lot of information that hasn't yet shown up in the public statistics. So in some senses, you guys are a great source of information to share with one another, and to be kind of telling us at a higher level, what you're seeing on the ground and how to pick that up. So I wanted to just kind of walk through how households respond to losing a job or losing their hours that's going to affect their ability to be in stable housing. And this is a complicated thing to track because people behave in lots of different ways. So for instance, if you lose your job but you have some money sitting in a checking account or a savings account, people often spend down their savings to continue making rent payments. And so we won't see them default on their rent until they've spent all of the savings down, right? But that means they no longer have a cushion, which is pretty bad too. We know that people are paying their rent with credit card if their landlord will accept that, and if they have enough credit on their balance that they can do that. They may be taking out other forms of short-term debt, which is usually quite expensive. Those are very hard to track with the sources that we have. And so we kind of know there's more of this going on, but we don't know how much. And that's increasing the risk for families going forward because they then have debt payments to make. A lot of tenants are negotiating with their landlords. Landlords are worried if people move out, they're not going to get another tenant who has a stable job. Most landlords are not trying to push people out if they can still get some sort of payment. So negotiating, you can pay half of your rent or 2/3 of your rent until you get back on your feet. We don't observe those very easily. When people do finally have to start moving out, many of them will move in with family and friends. We might pick some of that up in, say, the Pulse survey that we see more larger households or households saying they have people temporarily staying with them. We haven't seen a lot of that so far, but I would expect that to increase over time. And then the worst case scenario is that people lose a place to live. Maybe they can't move in with family and friends. They don't have space, or their family and friends are sick, and so they can't share space with them. And then people become homeless. And this will show up both people living in their cars, people squatting in empty buildings, and then people unsheltered living on the streets. One of the really alarming things is that we only know how many homeless people there are from a once a year point in time count. That happens in January. By next January, people may well have been homeless for a number of months. And so one thing that's really important is that we want to track the increase in homelessness, the increase in people doubled up living with families and friends. We want to know how much of this is going on and where, so that we can have resources ready and deploy them and prevent things from getting worse. This is not going to show up very easily in these kind of official data sources I'm talking about. So it's really important for those of you who are providers, who are working with households, to be sharing that information with your local government so that they can respond to it appropriately. So I will stop there, and I'm happy to take all of your, I'm sure, really insightful and excellent questions.
Well, thank you, Jenny. They're very important information. So one question that was posed was, you mentioned that the National Housing Multifamily Council puts out, of course, data based on large multifamily buildings. Is there any data available for the smaller landlords where about half the population of rent really do rent from people who have 10 or few or less units?
I mean, the people living in those buildings will show up in something like the Pulse survey, because that goes to any household that the Census Bureau has contact information for. So we will get some of this, but it's not necessarily broken out at a small level of geography or with a lot of detail about the property. So it's really frustrating. We sort of know that the most vulnerable tenants and the most vulnerable landlords are kind of these small mom and pops. In Baltimore, that's going to show up a lot in row houses that are rented out, or in a 2 to 4 family building. But those are also the hardest properties to track and to get consistent information on.
Mm-hmm. So back in March, April, and even into May, in the early days of the stay-at-home order, one of the roles that we were playing at various Federal Reserve banks was constantly calling different sectors, including landlords in the housing community, just so we could report back to our management as to what we were hearing and seeing. And at that period of time, people were bracing for what they thought was going to be a mass eviction situation or displacement. And then the CARES Act occurred. At the time, the National Multifamily Housing Council actually put out some numbers that said there was actually, because of the CARES Act, an uptick in rent payment in April for 2020 over what we saw in 2019, because people now were actually being given payment to provide. Now, your numbers suggest that over the long run, that did not sustain or in fact prove to be the case. Am I seeing that correctly? Or?
Yeah, it shows up in sort of subtle ways, and I actually didn't show the graph that tracks. So the rent payment tracker is updated every week, and so they show starting in the first Wednesday of the month, and then each week after that, the percentage of households who've made a payment. And a lot of people just don't get the payment in right at the beginning of the month. They're a few days late. They don't mail it, or they're a little short in their account. And so the percentage of households who've made a payment increases over the course of the month. What we saw was actually that the first month that the CARES Act kicked in, that there was a particularly large uptick. So a bunch of people who didn't pay at the beginning of the month, and then checks started coming in and they got caught up. And so that was one of the kind of indirect indicators that the CARES Act was really helping, that people were able to continue making this because of that. And obviously we'll be watching to see what happens when those checks stop coming at the end of this month.
I see. I spoke to also a number of housing developers who finance their projects through the low-income housing tax credit. And they obviously at that period of time in the spring were concerned that since rent wasn't coming in, whether or not they could sustain the revenue to continue to pay the financing arrangements under those tax credits. I have not, in my experience in housing, ever seen personally what would happen if somebody defaulted on a low-income housing tax credit. Have you heard anything about that potentially happening and what that scenario would look like?
No, and the tax credit properties are going to be especially complicated because they often have layers of financing with different kinds of terms. So, they often have subsidized equity that goes in. They may have a couple of different loans, some of which may be coming from public sources and some of which are just from private sector lenders. And many of the residents living in tax credit properties also have vouchers that cover part of their rent. So this is sort of a hybrid space depending on what the capital stack is for an individual property, and even individual tenants within the building. Some of them may have more ability to continue making payments. I will say that all of the properties that have some sort of a federal subsidy in them, HUD has more authority to put renter protections in place to say, public housing authorities can't push out tenants, or people living in Section 8 buildings where the whole building is subsidized. And tax credit properties have gotten some extra tenant protections. It's really the renters who are in unsubsidized, privately owned housing who are most vulnerable, who are not going to have a lot of protections, and in part because the landlords there are entirely dependent on rent payments in order to pay the expenses and the mortgage. And so the landlords also don't have a lot of wiggle room.
Do we have any data on whether or not, absent the CARE Act, any modeling of what eviction would have looked like absent that assistance?
We really don't. We've never seen something where this many people have lost income this quickly, and that it's been particularly concentrated at the low end of the income scale. So the pressures on renters. So this is a very different situation than, for instance, the Great Recession, where the sort of the problems in housing markets started among owner-occupied housing, right? So foreclosures among homeowners started, and then this rippled over into a larger recession and job losses that also affected renters. Here we're starting with the poorest and most vulnerable households first, losing income at very high rates at a time when there's really no replacement of income, and also when it's very dangerous to move out of your house. To move in with family and friends in a public health emergency is a completely different situation than if it's just your family and it's an economic emergency. So we have no historic equivalent to this. Our systems aren't set up well to capture this, and our models economist models do best when we take something that's happened before and then tweak it a little bit, but this is really a, uncharted territory for us.
I see. And then, as we know, as you may have read, Baltimore City, as well as a variety of areas within the Baltimore Metropolitan Council, are using the CDBG COVID-19 funding to provide rental assistance programs on a local level. Is that consistent with what you're seeing in other jurisdictions around the country, or is there something unique here, or so on?
Local governments are being as creative as they possibly can be to find money to help people and keep them in place. And so to the extent that they have some flexibility with their CDBG, either through the CARES Act or just other funds that they have, some cities have a pot of funds for sort of emergency rental assistance that they can deploy. They may have the ability to sort of move money across pots within the city budget in order to help out. The District of Columbia has a fairly small pot of money for emergency rental assistance that they have had for a number of years. And I believe the plan is to increase the amount of funding in that. So this is an urgent priority, and cities are trying very hard to make it work. Of course, cities are in a really difficult financial position at the moment too. They're seeing a loss of revenues from things like sales taxes, hospitality taxes. All of their main sources of revenue have taken a giant hit. At the same time, there's an increased demand on their services. So local governments are really squeezed in what they're able to do at the moment.
I see, yeah. So on the issue of creativity, somebody did post the question of whether or not any of the numbers are accounting for any type of national rent strike or a movement. Have you also seen any effort on the part of local government to simply, instead of financial assistance, somehow use the ability to simply stop or cancel rental debt?
We haven't seen, I haven't seen any local governments or state governments that have just canceled rent. And it's sort of hard to think through what the implications of that would be, and sort of how widely that applies. It's a little bit difficult if you're trying to say, we want to protect people who have lost jobs or incomes from the pandemic, but people who still have jobs and are able to make payments should be continuing to make rental payments, in part to keep the building and keep their fellow tenants afloat. And so governments have been reluctant to do an across-the-board freeze on rent, and they're also worried about sort of longer-term implications for the rental market. So there are a lot of smaller mom-and-pop landlords who don't have a thick profit margin, and who are gonna, if they can't collect rent and make their payments to keep the building up and running, they're likely to put the property up for sale. So we saw in the Great Recession, for instance, that a lot of smaller landlords had to sell their rental properties because they couldn't afford to run them. And many of those properties wound up getting sold to things like private equity firms, to institutional owners, who are then maybe less sympathetic to individual tenants saying, I can't make the rental payment. So we're sort of trying to balance, on the one hand, we want to keep renters in place, keep them stably housed, but we also want to support landlords, particularly of the naturally occurring affordable housing, to make sure that those properties stay in sort of the affordable, unsubsidized rental stock.
So I do want to, in the time we have remaining, open it up to the broad questions to the entire panel. But I do have a question for Dr. Sharfstein, which is somebody posted in the chat, which was, have we seen any potential COVID-19 patients or people seeking treatment get turned away from facilities due to lack of insurance? Has there been any evidence or any numbers tracking it?
That would be unexpected. I don't think so in this area. I have not personally heard of that. I mean, fortunately, in Maryland and in Baltimore, at the hospital level, at least, there's funding for people that covers the care for people who do not have insurance. It would be illegal to turn people away. And I have not heard that being a problem. I think the bigger challenge is that people may not seek care because they're worried about getting billed. And people could still get billed. If people show up, they're going to get cared for. So being turned away is less likely, but being less likely to go because of the bills if you don't have insurance, I think is a real fear. That's why some of us have been saying from the beginning that the federal government should assume the costs of all care. Even testing, there is a federal law to make testing free, but a lot of people have figured ways around that. So they'll charge you for the physical exam to figure out, or not even the physical exam, the consultation to figure out whether or not you need a test, and then the test they don't charge for. And so it makes testing in some places harder. Fortunately, the city has put out some free testing sites, but depending on how people interact with the system, they may wind up showing up at one of the places that's actually charging. So I think it's probably, the answer is probably not directly, but indirectly, the problems with our healthcare system are undermining the response.
Mm-hmm. So early on in the panel, somebody did pose a question, I think principally to Dr. Sharfstein, but I certainly open it to the panel, about what should happen with Baltimore City public school system in terms of should it open, when should it open, and in what form should that look like? And so Dr. Sharfstein, but also I don't know if
there's some breaking news on that topic, Peter. I don't know if
oh, really? Well,
that.
Perhaps you can share if you're comfortable.
Yeah, well, I think it just hit the Baltimore Sun website that the city has announced it's going to start online, and will reconsider creating in-person options for later in the fall. And that follows, I think, Anne Arundel doing the same, Howard doing the same. Baltimore County hasn't yet made a plan yet. I think my view has been it's a very difficult challenge. On the one hand, people are obviously concerned about the coronavirus and the potential, particularly for adults, but also for kids, to get sick and pass the coronavirus on and have the schools as a site of contagion, and obviously the fear that people could bring it home. So that's, I think, driving these decisions right now. But the flip side is that kids have really suffered for not having access to school. And both educationally as well as socially, the schools provide a lot of different types of services, from food to just generally assessment on how kids are doing, to the social environment that they need. So it's a grim situation, I think. And I think the school system was caught between two very unpleasant realities, and just tried to, buy itself some more time to figure this out. I think it's also playing out in a really unfortunate climate where this has been politicized, and you've got the president saying everyone just got to go back to school and not worry about it. That is obviously not a, I think, appropriate way to think about it. It's also, I think, the case that you could imagine with precautions, if the rates of infection in the community remain low, that you could have kids going back to school, smaller classes, cohorted, masking, and other things at a very low risk, like we've seen in other countries. So you're really hoping for some sort of middle path, but I totally understand why the school system is asking for more time to figure that out. I also think the school systems need resources. You need more space, you need more people. Teachers at very high risk should not be required to be in person. So you need, the school systems need resources to be able to pull this off, and that really hasn't been made readily available. I know there's some negotiations in Congress for that to happen, and that would be very helpful.
Agreed, and I think it further highlights the issue about the fact that if the school system is, as it appears, I'm looking at the Sun story myself, delaying their opening and relying more on online and virtual education in the interim, that of course the lack of equipment and access to households to computer equipment and broadband is only going to be heightened, and so on, and so on. So one of the issues we're focusing this Thursday. But on the issue also of schools, one of the things, Mike, for example, as you're aware at BMC, is that Baltimore City does not have a school bus fleet like other counties do. Our school children use the MTA and so on. How is there talk, or do you envision talk, that when the school system does open up, the Baltimore City school system specifically, whether or not that's going to play a factor in social distancing versus in other jurisdictions, about the fact that school children are riding the public transit system, assuming they're not walking to the neighborhood school, in a way that is not going on in other counties?
So it's going to be a conversation in the city and in other jurisdictions. I mean, the city, and aside from transportation, there's all sorts of logistics surrounding a return to school plan outside of student teacher safety and PPE in the buildings. But for the city, certainly students and families will have to make a choice or have the choice made for them that they will have to get back on public transportation to get to school. In suburban jurisdictions, you're starting to see surveys. The systems are trying to figure out exactly how many kids would come back in person and how many would need to be on a bus. The last estimate I saw, your average school bus can hold 60 children, and they were planning on having 12 children on a bus. So for the bus riding population, you're in order to socially distance on a bus, you're down to 20% capacity. So there's, aside from the highest level, most important health factors, there's all sorts of logistical questions about moving children to school safely, who's going to watch children after school while parents are working. We're trying internally at this point to assess daycare needs and what some of those shortages might look like. We had a online board meeting on Friday, and County Executive Pittman in Anne Arundel County raised this specifically. But there's a lot that needs to be sorted out on the periphery of going back to school, and transportation is just one of those things.
Appreciate it. Jenny, people were asking questions about also pending or predicted foreclosures and mortgage foreclosure. What I'm struck as a person who witnessed firsthand the 2008 and 2009 housing crisis, that there were efforts put in place, albeit reactive, to start putting financial institutions in places in a position, whether it be point of contact and other types of documentation, to facilitate people and help triage that situation. I'm struck by the fact that I'm not hearing anything from Congress at this time about, unless I'm mistaken, about just blowing the dust off of those legislative and proactive measures and getting that ready for what we think is probably going to happen.
Sure. So the CARES Act did include some protections for borrowers who have a federally backed mortgage, and that's actually a pretty large share of homeowners who have a mortgage through Fannie Mae, Freddie Mac, the FHA or VA. So a lot of borrowers are covered, and there was a little bit of confusion sort of how that was rolled out, whether it's the responsibility of the individual borrower to get in touch with their lender and ask for help, which lenders were proactively reaching out to people and saying, look, things are tough, we have provisions in place. The mortgage market is really complicated. So there's the bank that originates the mortgage, and there's the homeowner, and in between we have servicers. And so the bottleneck actually wound up being in the servicers, who get paid essentially for checks passing back and forth. And so if checks stop passing back and forth, then they lose their funding. So the mortgage market is complicated enough that it's not that easy in the short run to just sort of put a hold on things. But there is a fair amount of legal latitude and protection for borrowers if they run into trouble. We're starting to see upticks in the number of people who are defaulting on their mortgages, but it's not totally clear. Many of those should be covered, and so it may be that there just hasn't been clear communication to work that out.
For sure. Well, I do see that we are closing in on our time, and I want to thank our panelists who have been absolutely outstanding and extremely informative, and we will be sharing the information provided. I also want to thank our participants who not only asked some great questions, and I apologize I didn't get to all of them, but shared with us fantastic resources and information in real time. That's also what Baltimore Data Week is all about. Normally in an average Baltimore Data Day session, I would say each year that this only scratched the surface, and then I'd encourage you to further explore. Fortunately, we have a full week of sessions to further explore each of these topics and so on. So I really do encourage everyone to get their full Data Week experience this year. And also please fill out the survey so that we can evaluate how the session went. And with that, I'm going to turn it over to Seema Iyer, who will kind of talk to us about the week to come. But thank you again, panelists. Thank you very much.
Oh my God, what an amazing set of remarks from all of you. Josh, Mike, Jenny, thank you so much for kicking us off this week. Almost everything that you guys talked about, for better or worse, we have a dedicated panel for that topic. So for everybody else, for the rest of the week, if we want to talk about slow streets, we've got a panel on slow streets. If we want to talk more about the housing crisis, if we want to talk more about employment, we've got that tomorrow on Tuesday. But thank you so much for these resources. We're all trying to figure out how to get a handle on this using a data-informed approach as much as we can. The anecdotes and the stories are absolutely coming in, but we do need to try and figure out what this means from the long run. I do want to mention that the next session at 6 o'clock is all about COVID-19 dashboards. So Dr. Sharfstein's kind of overview of some of those dashboards, we're going to actually meet with the health commissioner at 6 o'clock and talk about the city, the Johns Hopkins dashboard, and BINA itself has a dashboard as well. So hopefully we'll see you then. And thank you so much for such an amazing kickoff. And thanks to all of our participants.
Thank you, everyone.
I think